Very good morning. Today's topic is on periodontal ligament. We'll be covering the introduction as well as the functions of the periodontal ligament in this lecture. So to understand the periodontal ligament, first we need to know about the attachment apparatus. So now we see here is figure of the mandibular molar. This is the crown of the molar. This is the root of the molar. So now this is the enamel, this is the dentin, and this is the pulp. So here the white border that's surrounding the root portion of the tooth, extending all the way from here to here to here to up to here. This is called as the cementum of the tooth. Now, this one here is called as the alveolar bone. So this is the alveolar bone to which the tooth is connected or anchored. Now, this is done by this tubular structure over here. This one. This is called as a periodontal ligament. So where is this periodontal ligament? It is seen between the cementum of the tooth to the alveolar bone over here. And where is it seen? It is seen in this space called as a periodontal space. This whole thing is a periodontal space, and this whole tubular structure is called as a periodontal ligament. Now, what is the extension of this periodontal ligament space? It extends from this portion here. This is the coronal extent of the periodontal ligament space, and this is the apical extension of the periodontal ligament space. Here it is starting from the apical portion of the lamina propria of the gingiva. So I told you this is the gingiva, this is the epithelium of the gingiva, and this is the lamina propria of the gingiva, or the connective tissue of the gingiva, in other words. For convenience sake, we separate it or divide it as the coronal portion of the lamina propria and the apical portion of the lamina propria. So the periodontal ligament space coronal extent is actually the apical portion of the lamina propria here, and the apical extent is the continuity to the pulp. Okay, so this is the attachment apparatus here. This one. This here is called as the dento-gingival junction. This we will see in detail in the next slide. So this is the dento-gingival junction. This is the cementum, this is the periodontal ligament, and this is the alveolar bone. So these four things together, the dento-gingival junction, the cementum, the periodontal ligament, as well as the alveolar bone together is called as the attachment apparatus. This connects the tooth to the bone, and it is continually adapting, continually changing, continuously supporting the tooth. So this area we will see in detail what a dento-gingival junction is. So now this is the dento-gingival junction. This here from here to here. So now this is the gingiva, okay, totally. And this portion is called as the epithelium. This is the epithelium of the gingiva. All this is the epithelium, and all this is the connective tissue or the lamina propria. The epithelium here itself has three types of epithelium. The gingiva, from here to here is the outer epithelium. From here to here is the sulcular epithelium, and from here to here is the junctional epithelium. What is the difference? This is the epithelium that covers the outer portion of the gingiva. Okay, this is a keratinized kind of an epithelium. Here you see the sulcular epithelium. This epithelium is facing towards tooth, but it is not attached to the tooth. So now if we leave an instrument inside here, like a diagnostic instrument, like a periodontal probe, if we leave it inside, it will be like a flap, like a petal. So this is not attached to the tooth. So you can easily pass the instrument up to this point. So when you put a periodontal probe, it stops over here because from here to here it is attached via something called as the junctional epithelium. So this is the outer epithelium. This is the sulcular epithelium which ends here, which is not attached. And from here to here, what is attached is called as the junctional epithelium. So this here, this entire thing is called the dento-gingival junction, and this entire thing is called as the dento-gingival unit. This offers protection to the tooth. So we now know that the periodontium is a connective tissue organ. So it is continually adapting. It is giving support to the tooth continuously. It is protecting the tooth. And it comprises of four elements: the cementum, the periodontal ligament, the alveolar bone, and the dentogingival junction. We should know that the periodontal ligament is a soft tissue. So the cementum on this side and the alveolar bone on the other side. On either side, these both are hard tissues, while this periodontal ligament is a soft tissue. And the principal fibers, that is, it contains fiber cells and all. So the principal fibers of these ligament are the collagen fibers, which will actually enter into the alveolar bone on one side and the cementum to the other side. So it forms a continual soft tissue continuity between the two mineralized hard structures. Okay, so the periodontal ligament width is between around 1.5 to 0.38 mm. So this is how periodontal ligament will look in a hematoxin eosin slide. So here we see that here is the periodontal ligament here, this light pink, and the dark pink lining is the cementum. Here, this is the dark pink lining, this is the cement. And here is the periodontal ligament, and this is the lining of the alveolar bone. And this part is the lamina propria of the gingiva, and this is the epithelium of the gingiva. Okay. So this is the same thing, and hematoxin used in staining in black and white. So here we see is the cementum. This is the periodontal ligament. Here we see the blood vessels over here, and here is the bone. So now you see this black dots over here. These are all the fibroblasts. So these are the cells that are seen in the periodontal ligament. So the periodontal ligament contains cells, fibers, and extracellular matrix. That is, it's a jelly-like substance in which the cells and fibers are embedded. Okay. So these cells, if you see, they are almost running in a perpendicular direction to the long axis of the tooth, like this. So this is why, because these fibroblasts will secrete these collagen fibers. So these collagen fibers will run in almost this oblique and perpendicular direction, so as to support the tooth. Okay. So this is how it is. See, this is an enlarged uh, portion of the same thing. So you see the fibroblast here attached perpendicularly. So this is the periodontal ligament, this is the cementum, and this is the alveolar bone. Now, how you see it in a radiograph or an X-ray? Okay, so you see this is a tooth, smartest black line running here, splitting the tooth all around here. It's a periodontal ligament. So this is a periodontal ligament space, and this white line here. Okay, this is the lining of the socket of the alveolar bone. This lining actually has these fibers. I told you there are these collagen fibers. So this is a soft tissue over here. These both are hard tissues over here. So this soft tissue here is going to extend its collagen fibers on either side into the cementum here and into the bone here. So this portion of bone here, where this soft tissue fibers are getting embedded, they're getting into the bone for that anchorage purpose. This is called as lamina dura in a radiograph. This lamina dura has got its clinical significance, which again we'll be seeing in the forthcoming classes. So we'll see certain facts about the periodontal ligament. It is thinnest in the middle portion of the root. So it has got an hourglass shape. So it is thicker on the coronal portion, thicker on the apical portion, and thinnest in the middle portion. And it progressively decreases in thickness with age. So it is around 0.21 mm in the young adult, 0.18 in mature adult, and 0.15 in an older adult. And normally the physiological periodontal ligament space as seen in a radiograph is between zero point 0.4 to 1.5 mm. Okay. So this periodontal ligament space in permanent teeth is a little bit narrower when compared to that of the deciduous teeth. Okay. And this fibrous connective tissue, it is cellular and it contains numerous blood vessels as well. So I told you the periodontal ligament comprises of cells, the extracellular matrix. So this extracellular matrix is a jelly-like substance. So in this, you will have the principal fibers like the collagen fibers, and the ground substance is mainly made up of proteins, polysaccharides, proteoglycans, etc. Okay. The main cells are the fibroblasts. So what are the different other names as a periodontal ligament could be called as is desmodent, comphysis, pericementum, dental periosteum, alveolar dental ligament, and periodontal membrane. It's most commonly used are periodontal membrane and periodontal ligament. So what are the functions of the periodontal ligament? Why is it even there? What is it going to do? Most importantly, it supports the tooth. We know that the tooth is subjected to all kinds of forces we use to chew our food, and also there is some amount of force which is falling on the tooth all the time. Other than that, there are other induced forces like the orthodontic forces, like the teeth are malaligned, you want to align the tooth. So to push the tooth into the desired positions, we use orthodontic treatments. So those are induced forces like the orthodontic forces. So when any kind of force is applied onto the tooth, the periodontal ligament towards where the force is applied gets compressed, and on the opposite side it gets widened. The compressed portion of the tooth, it supports the tooth by the following things. One is the collagen fibers. So the collagen fibers there, along with the water molecules in the extracellular matrix, all bind together and form a cushion. So this cushion is kind of minimize or prevents any damage from happening to the tooth. Okay. Other than that, there are blood vessels I told you in the periodontal ligament. So there is some amount of blood pressure. Okay, so it is constantly there inside the vessels. This is also going to give some kind of a hydraulic cushion to the tooth. Other than that, the widened part of the collagen, I mean the fibers. So what does this do? So we saw what happens in the compressed part. It is offering a cushioning effect. In the widened part, in the when the collagen fibers are getting widened on the opposite side of the force when applied, so this is not going to allow the tooth to move any further than the limit of the fiber. So it will only extend as long as the fibers extend. So it will only get displaced only as much as the fibers allow it to. So it prevents the tooth from getting moved very much far. So that displacement is minimized. Okay. So it actually acts as a suspensory ligament. It's kind of holding the tooth together in position in place. And there are lots of studies which has been done on tooth mobility, and they show these fibers have viscoelastic properties. It is also, I told you, like there are proteoglycans. These are part of the ground substance or the extracellular matrix that is present in the periodontal ligament. So there is some amount of actions that is happening between them. They aggregate, they come together, the molecules come together and they dissociate, disaggregation, they separate. And all these also give some amount of cushioning or some kind of support to the tooth structures. So the collagen fibers, the blood pressure and the vasculature, the ground substance, all together contribute to the support of the tooth. So the periodontal ligament as a whole, not just one single component, the whole of the periodontal ligament is supporting the tooth. So we'll talk about what is the sensory function that it provides. Okay. So we know that when we close our mouth, when the teeth comes into contact, we have the sensation that the tooth has come into contact. And when we are chewing food, we know how much of pressure we are putting, enough amount of pressure to have the food which is chewed appropriately or efficiently. So let us imagine when there is no sensations, like we are not able to feel when the tooth is coming into contact. We are not able to realize how much of force we put. We know that the muscles of our jaws are very powerful. If they are going to put more amount of force than what is required, it will result in the fracture of the tooth, in traumatizing the tooth and the supporting structures. So this is prevented. This is prevented by the sensations, the sensory function of the periodontal ligament. All the nerve supplies are present within the periodontal ligament. Okay. So when the tooth comes into contact, we know, so we stop. So when we are chewing our food, we know that this amount of pressure is enough, good enough to reasonably chew the food efficiently. So we stop. So this gives us something called as mechano-protection. Okay. So what are the elements that gives this kind of a protection? The cells, the stromal cells, and the actin-dependent sensory system. The act is nothing but a part of the cytoskeleton of the cell. So the cell, I told you, it normally the cell will have a cell membrane. So the cell membrane has something called as the cytoskeleton. This actin is a protein which is present in the cytoskeleton of the cell. So this plays an important role in the mechanoprotection. How does it do the cytoprotective function? There is something called as an active actin binding protein 280. It is a name given to the protein. So this does the mechanoprotection by how? One, it reinforces the membrane. So the membrane is reinforced. It is given an additional reinforcement which will prevent it from disruption or breaking away when force is applied. Other than that, it increases strength between the links of the cell membrane to the extracellular matrix. This also will prevent the disruption of the membrane. Also, there is one more thing is it desensitizes the ion channel activity, which will also give some kind of cytoprotection to the cells. There are four types of nerve terminations which are present, which is important for the sensations. Okay, one is the free endings. These carry pain sensations. There are Ruffini-like organs. These are mechanoreceptors, which are present at the apical portion of the tooth, and these are Meissner's corpuscles, which are also mechanoreceptors. It is also present in the middle portion of the root region. The spindle-like pressure endings are located at the apex, and there are smaller diameter nerves which will carry the pain sensation. There is intermediate type of nerves which carry the temperature, and the pressure is carried by the large myelinated fibers. So this also will be seeing in detail in the nerve supply of the periodontal ligament. So the next function of the periodontal ligament is nutritive. So it is having lots of blood vessels as we saw. So these blood vessels are going to supply anabolism. Anabolites are nothing but that elements that are taking part in anabolism. Anabolism is nothing but building up of structures, like from simpler unit to complex unit. And so blood vessels are going to supply proper nutrients for this to happen. So we know that there should be some amount of forming and breaking down together happening in a balance. So this is brought about by the blood vessels. Okay. So there is something called as catabolites. That is when the complex units are broken up into simple units, and these are removed from the system. So those are called catabolites. So this is done by the blood vessels. The next important function of the periodontal ligament is homeostasis. That is, the periodontal ligament is going to adapt continuously with varying intensity all through life. This has to be done like there should be some amount of formation, some amount of resorption, all happening at a pace in a balanced manner so as to maintain the physiological width and the functionality of the periodontal ligament. Okay. So now the principal cells of the periodontal ligament are the fibroblasts. The fibroblasts lay down the matrix, the collagen, and also it resorbs the matrix, the collagen and the extracellular matrix. Okay. Now there are two types of cell involved in the bone and involved in the cementum. That is, the cementoblast will do the deposition of cementum, while the resorption of the cementum is taken over by the cementoblast. In case of bone, it is the osteoblast that lays down the bone, and the resorption is taken over by the osteoclast. Here in periodontal ligament, both the formation as well as the resorption is taken over by the fibroblast itself. Okay. Now, the alveolar bone in the lining, the socket lining, seems to have a more turnover rate. That is, it is getting remodeled at a higher pace when compared to the rest of the bone of the jaws. Okay. And the collagen of the periodontal ligament has the highest turnover rate in the as in the connective tissues of the body, and the cells in the bone half of the periodontal ligament. That is, we know that the periodontal ligament is between the bone and the cementum. So that portion of periodontal ligament that is facing towards the bone is more active when compared to that of portion of the periodontal ligament that is facing towards the cementum. Now, we see that the cementum, that is the cementoblast, their activities is supposed to be much slower when compared to that of the activity of the fibroblast, and the resorption is also not a regular occurrence. Okay, so all this is happening so as to maintain the homeostasis, that is to maintain the physiologic width, dimensions, and the functions of the periodontal ligament. So now through this mechanism of resorption and formation, the periodontal ligament bit is going to be maintained throughout the life of the mammal. So this is called as a periodontal ligament homeostasis. Now there are various biological mechanisms which are involved in determining where the cell population is to be located. That is, which cell is going to form or which cell is going to resorb or which portion, say the cementum or bone. It is all happening in kind of a controlled biological manner. Okay. And the periodontal ligament cells, which synthesize and secrete, they also secrete certain molecules. These are called as regulatory molecules. These are growth factors or cytokines. So these will actually act and regulate the cell functions. There is something called as a factor which is called transforming growth factor beta. This is synthesized by the periodontal ligament cell. This causes mitogenic effect. That is, it allows for the replication of the cells. Okay, so it causes increase in the number of cells. So there is also other kind of such factors which actually increase, decrease, or differentiate all the different kinds of cells. So now there are other things called as the prostaglandins and paracrine factors which actually regulates the bone formation. So all of this together maintains the width of the period. So what happens if something is not happening in the correct way? Say some regulatory factors are increased more or it's been secreted more in the system. So what happens? So depending upon what kind of factor it is, it can cause a tooth ankylosis. That is, there is going to be increased amount of cementum formation. So the tooth is going to be totally anchored to the tooth. Like ankylosis, it is totally stuck to the tooth. There is no cushioning effect at all. So the periodontal ligament space is gone. It is not there anymore and is going to be totally stuck with the tooth. So that is called as tooth ankylosis. Or that could be a root resorption. This happens when the cementum starts resorbing. So there's no cementum cementum. So there's going to be some amount of root resorption that is happening. So in a radiograph, you will see it as a black area in the cementum portion where the cementum is totally disappeared. So there has to be a proper balance between these regulatory factors and the action of the cells that is taking place, so as to properly maintain the dimensions as well as the functions of these structures. Okay, so this balance is between the synthesis and resorption. So if disturbed, the quality of the tissues also will be changed. Say for example, we know that vitamin C and proteins are very important in periodontal tissue maintenance. So what will happen, say if there is no vitamin C or there's no proteins? So what will happen is, I told you there's going to be synthesis and resorption happening at a pace. Now the resorption will keep on happening, but the synthesis will not happen, because for synthesis to happen, we need vitamin C. So when the synthesis is not happening and degradation is happening at a faster rate, there's going to be destruction and loss of the substance in the periodontal ligament. So the periodontal ligament gets destroyed, and eventually it will lead to the loss of attachment. And then finally, what will happen is the tooth will become mobile, as how it is seen in scurvy. The spongy comes in, which is seen in vitamin C deficiency. Okay. So now there is death of certain amount of cells, and these are replaced by new set of cells. So this is happening at a pace. So this is all seen in a fully functional tooth. So all this is happening where the tooth is in function. What happens when there is loss of function? Say a tooth had a caries, or the tooth was extracted due to some reasons. So the tooth, say a mandibular molar was extracted. Now the opposing maxillary molar does not have a tooth to come into contact, so it is not functioning. It is not having any load that has been put onto that tooth. So what will happen on a tooth which is not functioning, which has lost its function? So there, the amount of periodontal ligament synthesis gets diminished. Okay, so what happens is the periodontal ligament space will subsequently get decreased, because it is not having enough load, because of which the function or the synthesis is not happening appropriately. So the width of the periodontal ligament decreases. The same way, if there's going to be an increased amount of load, say a tooth, say a filling was done and it had a high point or something, and it was not seen for some amount of time, and the patient has been biting for a long period, so there's going to be an increased amount of occlusal load which has been happening. Something like that, when there is an occlusal trauma which has been happening for a longer period of time, there is going to be increase in the width of the periodontal ligament space. This will all be evident in the radiographs. So with which we can say that this teeth is not having appropriate loading, or this teeth has got an increased amount of loading. So that is the significance of this periodontal ligament space. Now, if in case the tooth, again, say you replaced the extracted tooth again back, then probably it will return to its function, and probably this process is totally reversible. Okay. Now this is the picture of periodontal ligament. Here, this is the periodontal ligament space, which is in function. So now you see this is the bone, this is the cementum, and this is the periodontal ligament. This is the normal physiological width of periodontal ligament. We see the fibers, these are the fibers, and these are the fibroblasts, and this is the normal width of the periodontal ligament. This is in function. Now this is a periodontal ligament of a non-functioning tooth, which is not been functioning for a while. So this is the periodontal ligament space, which is decreased so much. So this is for us to relate both the cases. So this is the normal physiological width of the space, and this is the space of a tooth where there is no function at all. So now you see there is the cementum width is increased, and here you don't see any principal fibers. The number of cells are decreased, the width is decreased. So this is how it will look in a non-functioning tooth. So the next function is the eruptive function. So the cells and the vascular elements, the matrix proteins, all collectively will allow the teeth to have a limited amount of eruption. Okay, and they adjust the position when they are already attached to the bone socket. So now, if we see, like if a tooth is extracted, so we see there is a mesial drifting of the tooth, the supra eruption of the tooth. All this is actually because of the periodontal ligament space. This is also a function of the periodontal ligament. So the periodontal ligament provides space and it acts as a medium for the modeling, remodeling, and it has got a continued eruption, and a proximal shift keeps happening because of the eruptive function of the periodontal ligament. The last but most important function of the periodontal ligament is physical. That is, when a force is applied to the tooth, we know that it should be dissipated or transmitted in such a way such that there is no trauma to the tooth and the supporting structures. So this is done by the periodontal ligament. So the periodontal ligament takes up all the load and it transmits it to the jawbone in such a way such that the tooth is not traumatized, the supporting structure is not traumatized. Now, there are two theories that has been proposed to talk about the physical function of this periodontal ligament. One is the tensional theory, one is the viscoelastic system theory. What the tensional theory suggests is that when there is some amount of force which is applied onto the tooth, the principal fibers of the periodontal ligament, they say that these fibers are more important in dissipating the force onto the jawbone. So when there is force applied, the fibers get stretched, so the fibers get stretched, and this is in turn causes the elastic deformation of the tooth socket. So by this force is dissipated to the jawbone. So this is what the tensional theory says, but it is not much of an accepted theory. So the next theory is the viscoelastic system theory. In this theory, what they suggest is that when a force is applied to the tooth, okay, so there is a moment of force applied. So the periodontal ligament space has this fluid, extracellular fluid, matrix fluid. So this fluid is going to escape through the cribriform plate or the trabecular pattern, which I told you in the alveolar socket. So it is going to escape through it and enter the bone. Now, when this is happening, the fibers get slacked, they get stretched, okay? This will in turn cause the stenosis of the blood vessels. So the blood vessel is going to get occluded. When the fibers are going to stretch, the blood vessels get occluded. So when there is going to be an occlusion of the blood vessels, there's going to be an arterial back pressure because there's no supply of blood. The blood is not flowing through the vessel. So it is going to cause ballooning up of the blood vessels. So when there is going to be ballooning of the blood vessels, there's again going to be passive diffusion of the blood filtrate again into the system. So the filtrate from, I mean, the blood is going to get filtrated and it is going to enter from the blood vessel into the extravascular areas. So it is again going to replenish the amount of fluid that was lost before. So this way, there's going to be the tooth displacement is going to be minimized. So these are the two theories, and the viscoelastic system theory is kind of the most accepted theory. So these are the functions of the periodontal ligament. Thank you.